Hi, everyone, and welcome to another episode of Wellness Day, a podcast coming to you every Wednesday here from the Jehangir Wellness Center. My name is Kavas Jehangir, here from the JWC studio, and today I've got one of my favorite doctors. I shouldn't have favorite doctors, but I do have uh, Dr. Rahul Damle here. He's one of the leading orthopedic surgeons here in Pune, and it is a pleasure to have you here, Doc. Thank you so much for being here.
Thank you, Kavas, for having me here.
Dr. D, let me tell you why you are one of my favorite doctors, especially as an orthopedic surgeon, because I think it's pretty important. I think you have one of the best handshakes in the hospital. So I think as an orthopedic surgeon, that's a good that's a good sign.
True.
So thank you for being here, Doc, and let's get straight into it. First question: how did you get into this space as being an orthopedic surgeon?
I think probably a bit of a family legacy as well. My dad, Dr. Ajit Damle, is an orthopedic surgeon. And probably more than that, I think orthopedics is like a final endpoint to anything, meaning which whenever you're treating a patient, it's either a medical aspect or a surgical aspect.
Yeah.
Everything else while doing medicine seemed a bit abstract to me. Whereas orthopedic was, you have an X-ray, you have a particular diagnosis, and this is what you're going to do to treat that problem.
All right.
So it looked like a finite endpoint to the treatment where you do an XYZ surgery and the patient gets better, and that's the end of the treatment.
Okay.
So, and for me, surgery was always the key point of doing something in medicine. Everything else was not a hands-on approach. Of course, things have changed now.
Right.
Because a lot of people who did MD medicine now do a lot of interventional stuff
Yeah.
in cardiology, GI surgery, etc. But when I did my undergrad, it was either a surgical line or a medical line, and in the surgery line, orthopedics was always my favorite.
So you actually like to see your results.
Oh yes,
speak.
absolutely.
Which is actually important because for the people that you see, it's like someone who perhaps couldn't walk the day before can walk the day after,
yeah.
versus something like cardiology where it's all happening inside. So you may not
True.
you may not be able to see that. Well, that's a nice way of looking at it.
I mean, I don't think so I ever had a second option.
Okay.
So if it was not orthopedics, I always wondered what I would do. I don't
Right.
know. It was always the first and last choice for me.
Okay. So you obviously then you know the importance and the fundamental requirement of moving for the importance of it in terms of all our joints
Absolutely.
and
I
so
think
forth. So
what's more important is that the patient remains active and on his feet all the time. So that is why even in our real elderly patients, even at the age of say 80, 85,
right.
whenever they end up getting say a hip fracture, which is probably one of the most common things to get at that age, we are always pushing them into getting it fixed because we want them out of bed.
Yeah.
I think mobility is the key to everything. Mobility is life.
Absolutely.
So them being in bed even at that age is going to be catastrophic for them. So to give them a pain-free mobile hip, to get them out of bed at least for their basic needs in and around the house, I think is a key point for them. So whatever the age, what is the risk, it's always to get them pain-free, at least for nursing care, and to get them to do their basic needs in the house. I think that's a key point for everything.
Right. Yeah, and staying pain-free is such a important
Absolutely.
thing. And I mean, we can talk about what the most common things are that you see and stuff like that. But since you were talking about hips and being pain-free, I think one of the things that I thought of when you were just talking is that it's so, people can be fit and healthy, pretty much most of their lives. But a thing that most people don't think of or don't consider is that, one fall
Absolutely.
can, change that trajectory so fast.
And I think a key point here is prevention as well, because most of us, as we get elderly, we are going to lose our bone density, bone stock, and calcium content in the bones. So I think what we are doing here at the wellness center also was important is the bone density.
Yeah, absolutely.
Because in women, probably the change is a little more drastic as they get menopausal, but even in the male population, though the change is a bit gradual, all of us lose our bone density past the age of 60. So I think prevention is an important key because people don't realize, but as you grow older, you start losing bone density very rapidly.
Right.
And a small trivial fall, which in your younger age would have probably done nothing, you end up getting a hip fracture.
Yeah.
And then, when you get a hip fracture at 75 plus with your attending medical issues, life gets even more complicated.
Yeah. But what does that look like? For example, you're saying bone density decreases. Like, what does that look like for someone? Is it
So generally, it's what we call a silent killer.
Oh, exactly.
Until you have a look at it, you would not know what your bone density is.
Okay.
So most people realize they have osteopenia, oblique osteoporosis when they get a hip fracture. Well, it's a little bit late in the day.
Right.
Because even after you realize osteoporosis, to try and correct that, it's a very slow ongoing process and very painful procedure in terms of requiring injections, medication. It's a very slowly on-drawn process. So I think the key word here would be prevention and addressing the problem before even it sets in,
Yeah.
or it's a very early stage. So thereby getting an annual checkup, at least if not every year, once in 2 years,
Yeah.
to know where you stand.
So what should they be checking? Their bone
So
density?
yeah, the bone density, getting your vitamin D levels checked. And if you realize that your bone density is dropping off, getting it addressed with the corrective methods of basic calcium, vitamin D, and then if any medication if required, I think is a key in preventing hip fractures and spine fracture as time goes by.
Right. And what are the other preventive things that we can do
So the other preventive things you can
or
do
that you
is,
highly recommend?
yeah, so the preventing here would be maintaining a good muscle mass. Because most of us would get something called sarcopenia, that is loss of muscle as we grow older. And then muscle loss leads to imbalance, incoordination, easy falls. So that is the body aspect of it. There is a muscle mass and the bone density.
Yeah, yeah.
And the other things at home would be typically things like a night light. So preventing tripping over, preventing loose carpets.
That's a good one. I didn't think of that.
And those are the other things. So loose carpets around the house,
Yeah.
handrails, grab rails in the toilet, in
So
the shower
practical
area.
stuff to avoid
Practical
falls.
stuff, yes. That's the other keyword.
Yeah, because actually falls can happen even if you're a fit person.
Absolutely, absolutely. Just the age thing. So these are the things, especially in the elderly.
Yeah,
Because, you slow down with age.
right.
And a loose carpet or loose rugged house where you usually trip over. Those are small things which you don't realize.
Yeah,
A simple night light. Most people get up in the night to go to the loo or the washroom.
yeah.
And if there's no light before they realize, they've gone over. So
Right.
those are the other things which are definitely preventive methods because, and the problem these days is our longevity. About 30
That's a
years
word
back,
that everyone is using now
Yes.
as a buzzword, which is good.
which
but
is good and bad both.
Yeah,
Because with increasing lifespan, that people hitting 75 and 80 so easily these days, comes the added problem of getting a hip fracture or getting a lot of medical comorbidities as time
exactly.
goes by.
So longevity should go hand in hand with quality of life.
Most important, yeah.
Exactly.
Just can't be a number game.
Yeah, exactly.
Quality along with quantity. I
Right,
guess.
exactly. So, Doc, what do you do? Well, you talked about muscle mass and things like that. What do you do personally to
think,
give us? I mean, you got such a great or rather hand grip from what I said earlier today.
I think
So,
most
what do you do
orthopedic
to keep that?
surgeons should have a strong hand grip because we're doing a lot of physical stuff with our hands.
Yeah, as much as
Educators.
carpenters, as much as
Absolutely,
surgeons.
absolutely.
I mean, I don't want to scare people, but
No. But I think more than anything, I think being active, that's the most key word. And then getting your time, probably the gym or engaging some sport. Most doctors, I think, giving an excuse of I have no time is probably an easy way out.
yeah.
All
Good, I
of
like
us,
that you
I
said that.
guess, can find time,
Yeah.
or probably need to find time. Because really speaking, doctors, I think, in their most of us are in private practice.
Right.
So most of us never really retire. I think most doctors you see in private practice would continue working well into their 70s. Of course, providing the health permits, but most of us, the doctors, would continue working the 70s. So I think rather than thinking, oh, I would probably do XYZ sport later on in life,
Yeah.
it's important you find a work balance
Right.
in your work and in your personal life as well as in your health to try find a right way of balancing things. So as far as I'm concerned, I try to find time. Maybe I'm not a very early morning person, so getting up at 6 in the morning to get to the gym before work is not for me. So probably I find time later on in the day in the mid afternoon at probably 3 o'clock
Yeah. Yeah.
between my morning OTs and OPDs and
Okay.
evening clinic. I try to get to the gym 2-3 days
So
a
that's
week
not bad.
and probably play golf once a week on a Sunday for sure.
Right.
And if I get time in the middle of the week, I might just go to the golf course and play a quick 9 holes. But I love playing golf, so that is what I hope I can continue doing
Yeah.
well into my 70s, where most of the golfers are doing that. You so many people in their 70s and 80s at the golf course.
Yes.
Thrice a week playing 9 holes. So that is something which...
But as a surgeon, when you see, so many people coming in with various injuries and stuff like that, when you're doing your own sports, are you thinking of it from the standpoint of an orthopedic? Like, oh, if I do this, I might
Well, you
twist
can,
that, or I get...
I guess if you start thinking too much of the injury part when you're playing any sport, you'd probably never be able to enjoy it.
yeah.
I'm sure some other surgeon can fix me up in case I get injured to put me back on my feet.
Yeah.
So that's
I guess
part and parcel.
The question I actually was asking is, do you apply any of the stuff that you know as a doctor to your own
I think
practices of
I think
sporting?
probably remaining fit and probably I think wondering also how old are you and what can you do.
Yeah.
If you start picking up a sport, say a very contact sport like football or basketball, age of 50,
Right.
I think it probably spells more trouble.
More impact.
Yeah,
Yeah.
but probably if you pick up a low impact sport like a golf thing, or maybe an occasional once or twice a week pickleball thing, which is the in thing these days.
Yeah. And people are getting more and more injured with that.
Yeah, I know, but I guess it also depends a bit of your fitness as
Yeah,
well. You can't really jump into a sport at 50 when you haven't done anything for the past 2 decades
Yeah.
and expect to go all out. You're asking for injury. But I think if you're careful in what you're doing, I think you can enjoy most sports these days. I think. Why not?
Yeah. Absolutely.
I think Mr. Jehangir sir, I think loves playing.
Yeah.
cricket.
Dad has become a big pickleball.
Yeah, I know. He told me that.
And luckily he's fairly active, so
Yeah, I
he's
think,
not
yeah,
got
he's very
injured.
active,
But
yeah, and I think you guys are putting up a court at your home also. That's what he told me. I think.
yeah, he's going to start. Yeah, I suppose he's going to start having pickleball tournaments at home. But
That's what he told me last time when I met him.
yeah, but that's the thing. As long as he stays active,
Why not?
it's
No, he's very active. I think he cycles a lot. I think. And
yeah.
stuff like
Yeah.
that,
So it's a model for everyone else to
Absolutely,
keep
absolutely.
following.
Absolutely.
But coming back to you, Doc, you do lots of traveling and stuff like that as well.
So I don't travel too much for work. I mean, I travel for a couple of conferences a year.
Yeah.
But I probably take 2 or 3 breaks in a year just for travel. I would love to travel more probably for golf.
Right.
A lot of my friends travel for golf 2-3 times a year and play all over the world.
Yeah.
Unfortunately, in my line of work, it's like you have to be there for work.
Yeah. Of
No
course.
one
You have
else
to
can do
physically
that
be
for
there.
you. You have
Yeah.
to physically be there. It's not like you have a business where someone else is working even if you're away. So I haven't really traveled for golf so much. I probably do 2 or 3 annual holidays, breaks with the family.
Okay.
But I think that's good enough, I think.
Okay.
I'm not too big a fan on traveling. I like my life here in Pune. Area.
Okay. Well, the reason I asked you about traveling was every time we chat, you're always telling me about the fun places you go to.
Oh yes, so that's about twice a year. So that's good enough.
Yeah. But that also got me thinking about people who do travel a lot. You know, they're sitting in trains, they're sitting in planes, they're sitting in cars for, so many hours. How does that affect your joints over the long term?
So I think probably at my age it shouldn't affect. I'm just probably 50 plus. So at this age it should
50 minus.
yeah, 52. So that's okay. But I don't think so. I think travel should be fun. I think that's the most important thing. And most people do that. I would probably love to travel more. I guess, like I said, work demands are a bit different.
Right.
But even if I can get in my couple of rounds of golf in about 10 days, I'm more than happy here.
Okay.
Probably, maybe down the line, I would probably travel more for golf. But not right now. I think I'm happy what I'm doing right now.
Well, you'll be happier playing golf.
Oh yeah, I love playing golf.
Good.
Once or twice in 10 days is good enough. That's good enough.
Okay. Well, let's switch gears a little bit then. Let's talk about, maybe the future, or actually not even the future, the present now.
Absolutely.
And getting into, the kind of surgeries that you've been doing for over 20 years now. So you've got, huge amount of experience of knees and hips and so forth, and every other joint that we can think of in the body. Now with the introduction of robotics, has been around for a while, or people have been talking about it for a while. It's getting more and more advanced, and we've got some very, very cutting edge stuff here at Jehangir Hospital now as well. What is your perspective on robotics as a whole in orthopedics? Is it something that you feel is going to get rid of the doctor one day, or is it something that's only going to help you? What is your overall sense on
So
that?
I don't think so. Robotics would ever get rid of the human factor, at least not for the next few decades.
Good. Yeah.
But I think it's an important additive tool to the surgeon's armamentarium in the operating theaters.
Right.
So the way we have been doing joint replacements, at least me for the last 2 decades, it's a lot to do with your own personal judgment. So when we talk about, say, knee replacements, we used to use a lot of jig-based technology, or what we call a conventional way of doing things,
Right.
where you're looking at the pre-operative X-ray, using certain anatomical landmarks, and then using your own judgment, which you have got over the last 2 decades, and doing a...
So it's actually fairly not abstract, but it's quite subjective.
It is very subjective.
Okay.
It was very subjective. It is still.
Right.
Where there were no absolute values which you could look at when you're operating. So it was a lot to do with your judgment. So obviously my judgment would be a bit different than, say, your judgment or a third person judgment. So there was always a lot of human element to it, or very subjective. It was never that objective.
Interesting.
But what the new robotic technology has done, especially with the one which we have at the hospital, which is the Mako robot from Stryker,
Right.
is what we call an image-based system, where we do a pre-operative CT scan for the pertaining joint,
Okay.
and that data is then uploaded to the system. So even before we start the surgery, we have certain values and parameters with us. whereby we can decide what implant position, and then you can personalize the surgery for that particular patient depending upon his or her anatomy, wherein a 3D model is created beforehand.
Wow. Okay.
And then you have objective parameters as to what millimeters of bone you're cutting, what degrees you're implanting the new implants in, and what are the spaces, what we call balancing, you're looking at. So you have objective data available with you even before you enter the operation theater. Of course, all that is fine-tuned when you're actually doing the surgery.
Right.
But then it has helped us fine-tune the surgery in millimeters and in degrees, which was just not
Incredible.
possible before with the human mind or the human eye. And this is now much more reproducible and giving you more, I would say, better results.
Right.
So it's not that what we were doing was...
But by better results? Sorry.
Oh,
to
yes,
interrupt you.
definitely. So it's more accurate and it's more minimally invasive, and you have better looking x-rays later on because the angles and the degrees what you're looking at is much more accurate.
Right. So what does that mean? Like someone can end up walking faster, getting out of
So the rehab is
hospital
faster.
Right.
Because you're more accurate with that data and lesser dissection, lesser soft tissue dissection.
Okay.
So that definitely means less blood loss and less pain for the patient,
Right.
and faster post-op recovery.
Okay.
No question about it.
Right. But when you're doing the surgery, you're still in complete control of what's
Oh,
going
absolutely,
on. It's not
because
like a robot that's
No,
doing
it's
its own
not.
thing.
It's just a robotic assisted arm.
Right.
But it's what you call an active assisted system, where the saw and your drill is still actively controlled by you, whereas it has preset at certain degrees and certain angles as to what depth you're operating at, that the robotic arm helps you do it. But the trigger point is still very much in the surgeon's control.
Okay.
So it's not automated completely where the arm is cutting totally by itself.
Right.
Where the way you watch in the movie, where the robot can go completely off and somebody can hack it and
Yeah, I was going to say.
cause
scare a
havoc
lot
on the
of
operation
people.
that it cannot happen.
Okay.
The trigger point is still in the surgeon's control, absolutely.
Which is still what we want at the end
Absolutely, which is what you want at
Yeah.
the very end point.
of the day. Right. So, it's
it's
not like
not-
you can, in the middle of the surgery, go off and play a couple of rounds of golf.
No, you can't. You can't play a couple of rounds of golf for pure fuels. You have to be there. So the arm is totally in your control.
Okay.
It's just that the degree and the angle which you're cutting at, the machine is helping you do that. It's aiding you do that. But the trigger point is still in your control all the way.
So, I mean, now with, everyone advertising robotics and so forth, what is something that people should look out for when they're actually looking for what is actually a good robotic versus a...
So I think you need to, there are about 5 companies which have their own bots. But what you need to look at is which is the image based and which is imageless. What we have at the hospital at Jehangir is the image based robot,
Okay.
which beyond doubt is one of the probably 1 or 2 out of the 5 which are, the rest are all imageless.
Okay.
And the image based robotic is leaps and bounds ahead of the others.
Right.
So there's just no comparison between what we have and what the others have. So the image based of the Mako is leaps and bounds beyond what the others can offer.
Okay. So look at him.
There's just no question of it. I think you need to know what bot the surgeon is planning on using. It's just not a bot, it is which bot, which is the most important key over here.
Okay. Interesting future that we have.
Absolutely. I think this is the future. Right now, the bot which we have is for the hip and knee replacements. In the knee also, we can do either a total knee where you're replacing both the inner and outer joints, or we can do what is called a half knee or a partial knee replacement where you can replace only the affected medial or the inner compartment. In early arthritis where the outer compartment is not affected, you can leave it alone and you can address just the medial or the partial knee replacement.
Yeah.
And that again is a game changer with the robot which we have in hand.
Yeah, because you were telling me actually before we started that actually in the partial one, it's actually is where the value is really coming because you can...
Absolutely.
That's
Because
where,
you can fine tune the degree of bone you're cutting
Right.
and the angle which you're placing the leg overall. You don't have to overcorrect the knee. You have to leave it a bit undercorrected, so to speak. That's a technical jargon. But that is much more accurate with a robot than when you're doing it with your own hands because there's a lot of subjective error which can creep in.
Very interesting.
Very-
But
very-
coming back to the people and the patients that you see, what are the things that that you think that every time you see someone or you've seen so many people now, what is the thing that comes to your mind the most that I wish this person did this more rather than coming to the point where they've come to me? Like, what are the things that you think that people don't do enough of? I know we talk about exercise and stuff like that.
So
but
that is something which is within your control.
Yeah.
That is being active, being fit, not being overweight and exercising. But the other thing which always comes to my mind is most people when they know they have significant arthritis are still in the country are a bit reluctant to get it fixed. And they try to put off the surgery for as long as they can. Or probably, I think in our country, it's a lot of pain bearing issues. Most of them are just reluctant to have a surgery, even though it has compromised their quality of life
Right, yeah.
greatly for the past few years.
Wow, yeah.
So that means so many patients who come to us with end-stage arthritis, but probably where they should have had the surgery about 5 to 10 years earlier, because that would have meant a much more better quality of life much earlier than now.
Right.
They come to us at a point where they can barely make it to the washroom.
Wow.
And that is where I really feel sorry that if they have been probably educated or counseled earlier,
Right.
they probably would have had the surgery much earlier with a better quality of life where they could have got back to doing things earlier
Yeah.
and not really have to confine themselves to a house and confine themselves to a lesser quality of life.
It's like what we talked about earlier. Your the quality of life. Is
I
just
think that's
so
the
much
most important thing.
Right.
I think most of us are aging.
Yeah.
We are living
Most
longer.
of us are, right.
Yeah, I mean, we are living longer. So
Yeah. Well, tell me who isn't aging.
everybody is aging, but I think it's quality
Yeah,
which is
absolutely
more
right.
important than anything else.
Yeah, I completely
Most
agree with you.
important. Because on an average, I'm operating about between 2 and 5 80 plus patients, the hip fracture every month. So you can imagine how longer people are living in a society.
Yeah.
And so the numbers are just getting bigger and bigger of people hitting 80. 80 is just a very easy number these days,
Interesting.
which you would not see probably 2 or 3 decades earlier.
That's a good point. So what you're saying is that the average age of people that you're operating is getting older and older.
Absolutely.
Yeah. Which in a way, as you said, it's a bad thing, but it's also a good thing that it gives people, because I know people who think that, no, I'm too late, I'm too old to do surgery now, and then they compromise on
Absolutely.
X amount of
Age
years.
is just
as well.
not a number. It also depends on your fitness levels, whether you're fit enough to undergo surgery.
Yeah.
And if it is going to make a big difference to your quality of life, I think you should have it. My eldest patient, probably for a double knee replacement, albeit stage, not a single,
Yeah.
has been 89.
Wow.
So it's not that it's just the age.
And that put them back on their feet.
Oh, absolutely. In fact, I just met one of my patients, the golfers, the other day. I think the golf course starter just put out a message is that one of our oldest member to sign up for this year again at the age of 92. I had operated him about 7 years back when he was 85.
Yeah.
And even at 92, he gets in 9 holes of golf
Wow.
twice a
It
week.
must be such a great feeling
He's so
for you.
active. He's so active.
Yeah. Does he have a better handicap than you?
No. At 92, probably not. But I think he's just happy he's enjoying his 2 or 3 rounds of
Well, that's
golf.
such a lovely story. That must be,
Absolutely.
and that probably makes everything you do worthwhile.
Absolutely. As long as they're back on their feet, they're pain-free, they're enjoying their life, I think that probably speaks about everything.
Lovely. Well, I think that's a lovely note to leave this discussion on. But any last words that you'd like to leave us with?
No, I think probably what is more important in the hospital, I think what I love about Jehangir Hospital is like a home for me. I've been here for the past about 20 years.
Yeah, absolutely.
And, when you're at a certain place, you're always in a kind of a comfort zone.
Right.
This is where you're at the hospital. I told this to a lot of my colleagues. When you come here, it's like home. You know everybody around you. The hospital management, the colleague doctors, you always feel nice being at the
Yeah.
hospital.
You're always smiling, which is what I love.
Yeah, it doesn't seem you're at a workplace. I think it's just a home away from home for me. And I just love being here. And I think this is my first time at the wellness center here.
Yeah, yeah.
And I think you guys have done an amazing job here.
Thank you.
And I think it's probably, I would love to be back on the podcast sometime.
Well, definitely. Yeah, yeah.
And thanks for having me, Akash.
Thank you so much for those kind words. And as I said, we've loved having you here for
Thank you.
20 years and now for many, many more years to come with hopefully more robotics to help
Yeah,
you out.
absolutely.
Hopefully it'll help your handicap as well as we go along.
I don't think so. The robot is going to much for my handicap.
Well, thank you again for being here, Doc.
you,
Really
thank you.
appreciate it.
Thank you so much.
Thank you all, and we'll see you next week for another episode of Wellness Day. Thank you.